Hi everyone, my name is Patient Yu. Today my topic is vitamin D, the sunshine vitamin. Let's get started by the chemical structure. The chemical formula is C27H44O. The molar mass is 384.163. It has 27 carbon atoms, 44 hydrogen atoms, and 1 oxygen. Its covalent bonds, it has 74 bonds, which are 30 non-H bonds, 3 multiple bonds, and 6 rotatable bonds, etc. It's nonpolar vitamin, which means it's insoluble in water, and the physical properties and the chemical properties are white to yellowish, powder, odorless, and textureless. It's insoluble in water, it's soluble in fat. Here's the Sunny D. Sunny D, vitamin D. That's what we took when we were kids. We got a lot of vitamin D from it. Function 3. Function here, vitamin D acts as a hormone, supports the immune system, balances calcium and phosphorus. Epidermal keratinocytes are the only cells with metabolic pathway. Our skin, liver, and kidneys work together to synthesize vitamin D. Bone health maintains optimal bone health and preventing conditions such as rickets. Helps nerves carry messages between brain and body. Metabolism. Metabolic processes involves hydroxylation in the liver and kidneys. The enzyme CYP2R1 in the liver convert cholecalciferol to calcitrol. CYP27B1 in the kidneys convert calcidiol to active form calcitrol. A type of hydrogenation reaction is facilitated by specific enzymes, a series of chemical reactions rather than a single reaction. The reactions involved are not classified as endothermic or exothermic as they do not involve significant heat transfer. The ordinary recommends that 19 years old adults or older for 600 IU dating for men and women, and for adults older than 70 years old, it is 800 IU dating. If vitamin D levels in our body are too high, they cause harm. Levels above 15 to 16 are considered too high. Vitamin D toxicity or hypervitaminosis D symptoms are nausea, vomiting, poor appetite, constipation, weakness, confusion. Severe cases can cause kidney damage. Elevated blood calcium level, we call it hypercalcemia. Symptoms are excessive thirst, frequent urination, abdominal pain, bowel pain, increased risk of kidney stones. Here's the symptoms of too much vitamin D picture. So like diseases, headaches, fatigue. Levels less than 12 mg per milliliter indicates vitamin D deficiency, increased the risk of osteoporosis, weakened bones, prone to fractures, muscle weakness, and impaired immune function. Increased the risk to infections and autoimmune diseases. Potential links to certain cancers, cardiovascular diseases, and mental health disorders, such as depression. Possible reasons for vitamin D deficiency are inadequate sun exposure, age. When you get older, you lose vitamin D regardless. Limited dietary intake, obesity, kidney or liver diseases. Here the picture shows signs and symptoms of vitamin D deficiencies, such as dry skin, joint pain, immune impairment, and diagnosis. So most often we use CMP, BMP, and calcium blood test. The most important indicator is the levels of calcium in the blood. Also, the significant drop in phosphate levels may indicate. X-rays and bone mineral density scan And a bone biopsy may be performed to take a sample of bone tissues to diagnose it. Treatment, too much vitamin D. Stop taking vitamin D and calcium supplements, and we use IV fluid and hydration. We use corticosteroids and bisphosphonates and supportive care, and too little vitamin D. You want to increase the intake of vitamin D, like your dietary supplement, and you get a more sun, and high dose vitamin D supplements such as vitamin D2, vitamin D3. And you want to take a vitamin D rich food such as fatty fish, beef liver, and fortified dairy products like milk. Administration and the side effects of corticosteroids and bisphosphonates. Corticosteroids and bisphosphonates are both administered as orally IV injection. And when you take corticosteroids, you have to complete the 4 courses. We call it a taper, which means you can't stop right away. So normally it takes 8 weeks. The side effects are like risk of the adverse GI effects, weight gain, rapid mood swings, osteoporosis. Bisphosphonates administer same orally IV injection. The side effects of it associated with a small risk of osteoporosis of the joint. And that's my presentation. I hope you guys enjoy it. Thank you so much. And here's the references.